Hi there, I'm the neuromuscular mechanic, and today we're going to be talking about ultrasound guided chemodenervation of the abdominal muscles with a focus on the rectus abdominis, the external and internal obliques, and the transverse abdominis. So before I begin, my one disclaimer: the video that you see today has muscle of normal echo texture. It's of myself. Recognize that individuals with spasticity, you're often going to see muscles that are more hyperechogenic. So just bear that in mind. So with the first muscle we're going to start with is the rectus abdominis. So to localize this, take your probe in short axis. Recognize that the rectus abdominis is found sort of between the umbilicus and the midclavicular line. So between the midline and the midclavicular line. We're going to target this muscle if individuals are complaining of abdominal flexion spasms. I generally will see that in my patients with thoracic spinal cord injury. The benefit of the ultrasound is that it allows us to understand the depth of this muscle because we need to avoid the peritoneum, which is deep. And with this muscle, generally we're using low doses. So the textbook that I use, generally per side, we're using max 40 units Botox Xeomin or 160 units of Dysport. So we're going to get started here. So I'm sort of just off the midline, and now I'm moving that probe laterally. And there I have three layers. I have my overlying sub-Q or subcutaneous tissue. Deep to it, the muscle of the rectus abdominis or RA, and then deep to that, the peritoneum. And so again, this is roughly between the midline and the midclavicular line where I'm looking at this image. Now, if I do move the probe even more laterally, just to give context to where the rectus abdominis is, if I move even more laterally, sort of more lateral to the midclavicular line, then you're starting to appreciate the EO or external oblique and the IO, the internal oblique. And you don't see it well here, but deep to it would be the transversus abdominis. And so again, you can see the different localizations of these muscles. And so now I'm going back to closer to the midline. There's my rectus abdominis. I'm scanning sort of up and down, and I could inject any one of those spots. Now with the next set of muscles, the obliques and the transversus abdominis, again, you take your probe in short axis, and as I just sort of alluded to, it's lateral to the rectus abdominis. And these three muscles have a very sort of rigid anatomical distribution in that the external oblique will always be superficial, the internal oblique will be in the middle, and then the transversus abdominis will be deep. And again, we need to avoid the peritoneum. Now with these muscles, why might you inject them? Well, if you're having bilateral activation of the obliques or the transversus abdominis, that'll cause abdominal flexion. So if somebody's complaining of abdominal flexion spasms alongside the rectus abdominis, you may inject these muscles. If there's a rotatory component, so if there's rotation contralaterally, that's what the external oblique is contributing to, and then the internal oblique and the transversus abdominis would contribute to ipsilateral rotation. So depending where the direction of that rotation, you'd be targeting these muscles as well. And the side, again, would depend. And you're using, again, low doses, lower than what you'd use for the rectus abdominis. So we're going to start here with the clip. What I've got here is there's my rectus abdominis. So again, I'm roughly sort of just off the midline between the midline and the midclavicular line. What I'm going to do now is I'm going to take my ultrasound probe in short axis, and I'm going to scan laterally as I did in the previous video series. So as I scan laterally, the rectus abdominis is disappearing, and then what I'm seeing are three muscle layers. So I have the first superficial layer, which is relatively hyperechoic here, the EO or external oblique. And then deep to it, relatively hypoechoic, we see the IO or internal oblique, and then deep to it, the TA or the transversus abdominis. And again, I could target all three of these muscles in this location, potentially bilaterally to help with abdominal flexion spasms, or depending if there's a rotatory component, I may be targeting things as well. And so there again are those three muscles, and they're lateral to the rectus abdominis. So that concludes our video today. I'm the neuromuscular mechanic, and I hope you found today's video series handy. Take care.